How do you diagnose that the patient is suffering from the epileptic seizure activity or not? This is obviously sometimes quite confusing. You carry out the baseline investigations in the patient as a routine, and then you move on to the specific testing techniques as well. So over here, you have the lab studies in which you'd carry out the routine blood tests, and that is basically going to highlight a lot of factors. Either the patient is suffering from some sort of an underlying infectious state or not. We'd be having a raised ESR in that case. The WBC count can be increased. So you're going to focus on the particular factors over here. Either the patient is suffering from any sort of an anemic states or not. Serum autoantibody testing. So there are a lot of conditions in which there is an autoantibody states that the patient can have. Then we have the CSF autoantibodies that the patient is going to be tested for. Then obviously there are a lot of radio imaging techniques that you're going to carry out for the patient. The electrophysiological studies that we're going to focus on over here, particularly we have the electroencephalogram. Sometimes it is not quite possible to record the EEG recordings specifically because these EEGs are carried out after the seizure activity has been put forth. So you're going to look for all of these findings. Either you can catch an activity over here or not. Then obviously you're going to move on to the magnetoencephalography that is also carried out over here. The imaging techniques that are particularly put forth for the patients are the MRIs, that is the magnetic resonance imaging, and you look for the tumorous activity or any sort of tumors that can be found over here, any sort of history of head trauma. And after that head trauma, when you carry out these MRIs and radio imaging techniques, that is going to highlight the positive findings that you can focus on in the particular patient. CT scans are also carried out for the patient, and they are also going to highlight these factors over here.